Hi everyone, my name is Garcia Siam, and this is a presentation on health information and privacy of medical records. Health information and the privacy of medical records are important topics associated with federal and state and laws and regulations. Health information refers to a patient's personal information relating to their health. Some of this information can include patient visits, vital signs, medications, diagnosis, and treatments. Healthcare organizations are required to protect this type of information in the medical records storing this information. One of the most influential laws protecting health information and medical records is the Health Insurance Portability and Accountability Act of 1996. HIPAA is a federal law which requires national standards to protect health information from being shared without the consent of the patient. The United States Department of Health and Human Services designated the HIPAA privacy rule and HIPAA security rule to implement and protect HIPAA requirements. According to the Department of Health and Human Services, the privacy rule was finalized in 2002 and set national standards for the protection of personal health information by covered entities. Additionally, the security rule was finalized in 2003 and aims to establish national standards to protect confidentiality, integrity, and availability of electronic PHI. In 2009, the HIPAA privacy rule was modified by the Health Information Technology for Economic and Clinical Health Act, also known as HITECH. HITECH updated the individual right to access individual electronic health information covered by entities and their business associates. HITECH also stimulated information technology adoption by hospitals and healthcare providers to include electronic health records. HITECH also introduced the breach notifications rule, which requires covered entities to report data breaches to patients and the Office of Civil Rights, a rule that also applies to business associates. Some laws and regulations pertaining to health information and medical records are at the state level. In California, for example, the Confidentiality of Medical Information Act, or CMIA, is a law that is set to protect individuals' medical information obtained by healthcare providers, health insurers, and their contractors. CMIA was amended to set administrative fines or civil penalties for any person or entity, including licensed healthcare professionals, who purposely obtain, disclose, or use medical information unlawfully. On several occasions, covered entities have found themselves facing legal cases because of violating HIPAA requirements. As a result of being found guilty, healthcare entities can face significant consequences and OCR can apply a fine. Table 1 provides a breakdown of possible fines healthcare organizations can encounter. One relevant case pertaining to HIPAA violations involves Banner Health, which is an organization that was found non-compliant with HIPAA. On February 2nd, 2023, OCR announced a settlement of the HIPAA investigation with the Arizona hospital system Banner Health. The investigation was originally initiated by OCR due to a hacking incident that disclosed the PHI of 2.81 million consumers in 2016. As a result, Banner Health agreed to pay OCR $1.25 million in addition to corrective action plan requirements. Another recent case involves Life Hope Labs, LLC, an organization that was found also in violation of HIPAA requirements. On January 3rd, 2023, OCR announced a settlement with Life Hope Labs. In this case, Life Hope Labs violated the HIPAA Right of Access Initiative, which requires healthcare organizations to provide records to patients in a timely manner. This example, the individual requested medical records on July 7th, 2021, but the records were not received by that individual until February 16th, 2022, which was a time span of 7 months in order to get records. According to Davis, Life Hope Labs agreed to pay OCR $16,500 in monetary penalties, in addition to corrective action plan requirements. A case last year in 2022 involved New Vision Dental that faced an investigation due to disclosure of patients' PHI. This investigation was initiated by OCR in response to New Vision Dental's violation of the HIPAA privacy rule. In this case, New Vision Dental was responding to social media reviews and comments and disclosed PHI in the process. In addition to agreeing to a corrective action plan, New Vision Dental faced an OCR penalty of $23,000. The enactment of HIPAA and other acts related to protecting PHI have impacted healthcare in various ways. One positive outcome of high-tech, for example, is that prior to the act, only a handful of healthcare providers were using EHR systems. But after the act and $34 billion in incentives, nearly all hospitals and 80% of doctors' offices were using EHR systems in 2019. Another benefit of HIPAA and its impact on healthcare is that it helps streamline healthcare functions, including the transfer of electronic information between healthcare providers and health plans. There are some negative impacts of HIPAA on healthcare. According to HIPAA Info, one of the original conditions of HIPAA was to establish a national patient identifier system, which would prevent record mismatch within healthcare companies. In addition, in order to comply with HIPAA, some organizations were forced to invest in renovations to accommodate a more private space, invest in employee training, and enforce new policies. So this is money that could have been used to improve patient care. Since HIPAA's enactment in 2016, there have been multiple changes. On May 11, 2023, the COVID-19 notices of enforcement discretion will end. The notices of enforcement allowed for HIPAA enforcement of compliance to ease and allowed for telephonic and virtual appointments through the COVID-19 pandemic. This allowed providers to use FaceTime, Skype, Zoom, and Google Hangouts to provide medical services without facing any penalties for not using HIPAA-compliant platforms. With the elimination of telephonic and virtual appointment possibilities, this may take steps against the progress made in using telephonic appointments for reaching more patients. Many individuals benefited from these types of visits, and it would be ideal for HIPAA and the Centers for Medicare and Medicaid Services to add telephonic and virtual visits to their services. In regards to how this impacts my work and my current position, I currently work at Elevance Health. Specifically, I work under the CareMore Health line of business that performs outreach to members of various health plans to schedule Healthy Start or Healthy Journey appointments, which are head-to-toe health assessments. We outreach to a total of 65,000 members throughout the United States to get them in for in-person appointments. Our priority is to schedule in-person appointments at the member's local care center, and as a rebuttal, if the member refuses the in-person visit, we can schedule virtual or telephonic appointments as well. Telephonic and virtual visits have often been used to accommodate members that request sooner appointments than the next available in-person appointment. This practice has improved access to many of our members. The elimination of telephonic appointment availability and the limited capacity for on-site visits will negatively impact healthcare, not just at my job, but at many other organizations as well. HIPAA compliance is a significant part of my everyday role. Part of my job is also to ensure that my team members are not violating HIPAA requirements or expectations. As part of our team, we have a team of quality auditors as well that screen 2 calls per rep per month. HIPAA verification is something that holds a critical weight in the scoring of the call. Therefore, if an agent misses a portion of the HIPAA verification process, they're likely to score a low percentage on that call. It's difficult to say that I'm looking forward to the upcoming changes to HIPAA, but I am optimistic. I hope that changes reflect the lessons we learned during the peak of the COVID-19 pandemic and keep those temporary changes that have benefited the patients and allowed healthcare organizations to continue providing services through the pandemic. Thank you all for your time.